Good afternoon, everyone. Thank you for gathering with us today. So we're going to share some of our learnings as we work towards integrating the social determinants of health into a digital solution for First Nations. The work that we're sharing today is part of a larger project called the Indigenous Digital Health Ecosystem, and it's being led by Mustimuk Information Solutions with a selection of valuable partners such as Infoway, Cambion, LifeLab, CGI, and of course TWU, which I'll be introducing shortly. The IDHE project is developing a new culturally aligned digital solution and platform with a suite of integration solutions that will better meet the needs of the First Nations. If you're interested in learning more about the IDHE project, there's a concurrent session happening tomorrow at 11 a.m. But back to integrating the social determinants of health, Mustimuk has partnered with TWU, Trinity Western University, and we are working towards researching key social determinants of health and quality of life frameworks to better meet the needs of First Nations, and that's going to be done through Mustimuk's work with the IDHE project. So TWU and Mustimuk have worked together for the past year and a half, and today we'd like to share some of our learnings with you. Before I switch it over, I will introduce myself. So my name is Riley Baldwin, and I'm a settler on the lands of the Coast Salish people. I work for Mustimuk, a Cowichan-owned tribe company, and Canada's leading health and service provider of health and service information systems, specifically designed for First Nations.
My name is Kathleen Lounsbury, and I'm from the northwest tip of Vancouver Island. I come from the Kwakwakik traditions of the Muskmut Audinuk people and the Tlawichi-Smamtagela people. And I am so proud to stand before you today. I am a doctoral fellow on the IDHE project, and my portion of this project was to do a literature review and a knowledge synthesis process of the social determinants of health, and actually to identify the Indigenous domains of social determinants of health that actually will inform this platform. And it is such a hope that this work is going to be relevant and going to add so much that is missing in Indigenous health and what has been very, very hard to navigate. And so part of my work has been to identify those through the literature review, and it has been a journey, let me tell you. Thank you very much. Okay.
If I can figure this out. My name is Ayumi. I am a PhD candidate at UBC and currently also doing a postdoc internship for the IDHE project at Trinity Western University. I am an uninvited guest, came many years ago from Japan to this land of Musqueam, Tsleil-Waututh, and Squamish peoples, and I'm very grateful for the time and the space that we share today. So in looking into this project, one of the first things that am I going back? There we go. Yes, green is always the one, right? Yes. So we were looking into the measurement framework for the social determinants of health and quality of life for Indigenous peoples. So some of the questions that we had for this aspect of the project was, well, what is social determinants of health and quality of life for Indigenous people? How do people actually conceptualize it? So in looking into this, one of the first things that we did, there are several ways that we went about this. As Kathleen has mentioned, one was through the literature review. Another aspect that we went through this was forming a learning alliance table of Indigenous knowledge keepers, such as elders, and service providers who work in Indigenous communities to ask, so in this community over here, what are important aspects of health and well-being? So from there, we heard many voices. Some of the key things that came up time and time again was, well, there's this traditional way of being, right? And in order to look at this, then the indicators will be different, right? There are other domains that are not really being captured at all in these areas. So I bring up some quotes from these Learning Alliance tables that were described over here. So we have our traditional lands, and for generations, we all came here to share. We have our own traditional ways of helping one another. We have our own ways of healing. If you just focus on the red part there, over there, how many youths are participating in ceremonies, how many are doing naming ceremonies, how many are attending clinics, for instance, with their elders, births in the community instead of hospital in a community birth. And parts of our ceremony, that's part of our connection with the Creator and connection with everything in this earth and the elements. And so these ceremonies are so critical, and these are aspects that just weren't really being captured. So that's one thing that we noticed from some of the Learning Alliance tables. I'll pass it on to Kathleen to discuss a little bit more about the literature review.
Okay. Great. So as a doctoral intern on this project, what I wanted to do was represent what I was learning from the literature review in an Indigenous way of knowing, and in my culture, my Kwakwaka'wakw culture. And so I use a Kwakwaka'wakw sun with the face at the center, because that represents that more than human relationship, that relationship that we have with the earth, the relationship that we have with the beings that are under the earth, over the earth, and upwards of the earth. And so this is really, really important to understand. And so you'll see here that I have identified different domains, but within that, before that, I have race and discrimination there, and I have colonization there, because those things radiate out and influence all the other domains. And in my reading, that was evident, like in so many different ways. And so, for instance, a domain of Indian residential schools as a social determinant of health. That is so very important to understand, that there are health consequences, there are ways in which those people and those families interact with one another because of the Indian residential school. That is a determinant of health. I want to take also a look at Indigenous sovereignty. And we are sovereign people on this land, and we walk in sovereignty. There's no question, but that isn't captured in the data. And I wanted to highlight that as something that was incredibly important as a determinant of health. How we see our lives, how we see our traditions as important to our health, how it speaks to who we are, what we are, and how we operate. Very, very important. And another thing is, another idea, I'll just talk a little about land. Land as a determinant of health. Land isn't something that is just a commodity to be traded. Land is something that is spiritual. It is transcendent. It gives. It is our first teacher. These are things that are important. It nourishes us. We nourish it. We have a relationship, a deep relationship with the land. I said I was from Alert Bay. That name actually means nothing to me. It's actually Yalis, which means the opening. That has something, that has meaning to my way of knowing and being. Alert Bay means nothing, but Yalis means something, because that calls me to my home. So very, very important. So I just want to mention this. This is just something that is a work in progress. I wanted to express who I was and my way of knowing and being as a Kwakwaka'wakw person in this process. So just wanted to share that. The next slide, oh, sorry, I went the wrong way. Got to learn how to do this. Please go forward. Here we go. Yay! Here we go. All right. Oh, and I went too far. Let's see if no, it's not going where I want it to go. Hang on, somebody. There we go. Please stay. No, okay, I'm gonna leave it alone. Hang on. Let's let it just hopefully. Please come back.
There it goes.
There it is. Yay! Awesome, we finally came here. So I want to just mention my colleague, who is Monica Friesen, and who's done such amazing work. And so she was doing the Indigenous quality of life knowledge synthesis piece. And she created this beautiful framework of the center. I want to focus on that center. That center highlights real deep principles of interconnectedness and interrelatedness as part of an Indigenous way of knowing and being. And you can picture that center saying, you throw a rock in there, and you throw that rock, and that rock then ripples, and it ripples and ripples and ripples outward. And so it has an effect outward. And you can see each of those different domains that she identified in the literature is so very important, and it's interconnected and interrelated to one another, which is incredibly important because these different pieces, self-determination, environment, spirituality, these are things that aren't in the literature, that aren't demonstrating. The literature is not literature, but different frameworks, let's just say different frameworks that don't quite address the Indigenous way of knowing and being and what determines our quality of life. So I just want to talk a little bit about, you know, identity, language, and culture. There's so much more: kinship, community. We're going to go forward now. But this is just a beautiful, I just have to mention Monica Friesen. She did an amazing job here. Let's hope it goes great. So it did. And so these are Indigenous quality of life knowledge that she came up with. She's actually Indigenous to Taiwan. And so she has some beating patterns that she used to as part of her growing and learning and working with the Knowledge Synthesis Project. And she identified autonomy, self-determination. She identified culture, identity, and language as being part of what is a quality of life. It's important for our quality of life that we are involved in our cultural ways of knowing. And if we're not involved in our cultural ways of knowing, that is a story too. So either side, it's very, very important as Indigenous people. There's a story on both sides. And of course, family, community, and kinship. We understand each other, we work in community. Very, very important. As I spent 18 years in the community as a community health nurse. And so much of what we know and how we are is nested in these principles here. And so again, the autonomy and self-determination, we need to be in a place where we are determining our future. We need to be doing that. The answers are within us.
Okay, nope. All right. Just once. Just click once. We conceptualize our work as a process of weaving the different pieces of knowledge together, the literature reviews that we do, the gray literature search, the hand searches that we do, the Learning Alliance table and the voices from there, stitching together the different conceptualizations of social determinants of health, quality of life, the holistic interrelated components of it.
So as Kathleen and Amy have just highlighted, there is strong evidence emphasizing the importance of the quality of life and social determinants of health and what domains need to be included in an Indigenous framework to accurately represent Indigenous wellness. So the question now becomes, how do we harness this knowledge to create practical solutions for First Nations? We're finding that there's two key well-established fields of knowledge when it comes to creating practical solutions. There's literature learnings, highlighted by many of us here today and by my two partners. And then there's the common digital health integration. So everything you think of about data standards, privacy and security, technical requirements. And there's a relationship between these two that help make practical solutions. However, we're also finding that that relationship between the theoretical and the practical does not exist when it comes to creating tools for First Nations. There is a gap in how to appropriately harness that Indigenous knowledge, the foundational principles of Indigenous knowledge, and bring that to life in an actual digital solution. So when we think of what we need to fill, we call it a gap, but it's really a livelihood of information that's there from the Indigenous perspective. So to fill that void, we need to use Indigenous knowledge to bridge that relationship. So what does it look like to use Indigenous knowledge? Well, Indigenous knowledge will help us create solutions that are relational, holistic, strength-based, so looking at that positive perspective, not always looking in the past, and also has to be adapted per community. When we use Indigenous knowledge, it's looking at how First Nations for decades have defined Indigenous wellness and using that to propel forward how we guide these technical requirements. Indigenous knowledge can help us integrate ways of nation thinking in addition to individual level thinking. And nation-based thinking has to take on an approach of what are Indigenous measures of success. So an example of that would be talking to communities to understand what Indigenous measures of success for indicators could be. And an example of that would be measuring the number of acres of land a First Nation per year has reclaimed. To do that properly, digital solutions need to adapt and change what counts as a measurement framework and what counts as data. There's an abundance of unrecognized Indigenous knowledge that if we integrate it into a digital ecosystem would help make more appropriate health measurement frameworks to help First Nations have their own data in their hands to help build their nation rebuilding journey and journey to sovereignty. So we all know that we need to use patient voices, community voices, and that is especially essential when it comes to Indigenous perspectives of wellness. So what would a First Nation and Indigenous social determinants health framework look like? Well, Mistimak, with our partners, we're creating a social determinant framework that provides valuable insights for First Nations to help drive their decision-making and priority setting. Access to social determinant health data will help drive nation rebuilding and their journey as they want to see it to sovereignty. The social determinant framework is being designed with key considerations, a few of them being that the framework will be driven primarily by nation-based data in addition to individual level data. So nation-based data looks at the whole health of the nation from their perspective, and also think of it as a bird's eye view. So everything from environmental, the individual, infrastructure, it all needs to be included in that nation perspective. A few examples of potential indicators could be looking at the nation's journey of self-governance over their own education, looking at what infrastructure they have in place for fire safety, and looking what their status is of their emergency preparedness plan. Another key consideration is that the framework will be designed for point of service data collection or real-time data capture in addition to or opposed to just relying on social determinant health screenings and surveys. A third consideration is that the framework needs to collect data and be able to share data across all departments. We've talked a lot about sharing data and interoperability today, but social determinants health for an Indigenous perspective really has to be interconnected, and for service providers to be able to act on social determinant health data, they need to be able to share, to identify, and follow up on that data. So there's lots to learn. We're always learning more, and especially when it comes to integrating the social determinants of health. And a few key opportunities ahead that we see is that we need to rethink how privacy and security models are going to fit into an interconnected model for the social determinants of health. That social determinant of health is extremely interconnected between housing, education, health, child and family services, and to be able to provide that data sharing accurately for service providers to act on it, we need to reimagine a bit what we consider privacy and security and how that can be safely shared to be able to act on it appropriately. Another learning opportunity is that social determinant health data standards and screening tools are still under development. So this is a great opportunity that as those develop, we can also create data standards and social determinants of health screening tools that align with Indigenous language and workflows. And we see this working really well in parallel together at the same time. We also recognize that this is a great opportunity to listen to First Nations, to understand how technology can be leveraged to collect data that is extremely sacred. This means not shying away from data measurements that have previously gone uncollected because it is hard to measure. It means reimagining what we count as data, how we measure that data to better represent Indigenous wellness in an accurate reflection in a digital solution. By no means do we have all the answers, but with great partnerships, the right voices at the table, we can create digital solutions that accurately represent the well-being from an Indigenous perspective.
As Riley had mentioned up until now, the important concept about this is to make sure that we're continuing to listen to the Indigenous voices and their guidance and their perspectives. If we had just focused on one Learning Alliance table, what we're doing essentially is fitting the voices into a system. No, that can't be the case. What we're hoping to do is to create a system that truly incorporates the Indigenous perspectives. So to end or to conclude the presentation here, we have a couple of voices from the Learning Alliance table that's read out by some of our team members. I'd also like to express my deep gratitude to the Learning Alliance members. Here I name two names who have acknowledged and have stated that they are okay to be stated out loud and acknowledged out loud. So Lillian Underwood and Norma Rabbitskin, thank you very much for your help, and all the other Learning Alliance members. Sure, I pressed it.
We are actually inheritors of a great knowledge, a great deal of the Indigenous knowledge that comes from the land. And right on these lands, right where we are now, we've always been here.
So to me, that's health and well-being. Being connected to your own traditions, your own rituals, your own foods, your own everything in the community.
We also need to look at the ideal, where we want to be the restoring of kinship, restoring of one's health and well-being, living well with their diabetes, living well with their health conditions, utilizing, empowering them to take ownership of their health.
Thank you. We'll be here for any questions after the presentation.
Ayumi, Riley, Kathleen, thank you so much. That was really, really informative. And I remember having conversations with Perry Cargard and Mark Summerfield. This initiative was just getting started and the funding was just going forward. So congratulations on the amount and efforts and things that you've done. A true ecosystem and truly patient-centered. So congratulations and thank you for sharing with us.